Thank you. Now we'll hear from Dr. Meza. Oh, Dr. Levy, I'm sorry.
This is work that I've done with some others who also deserve a large part of the credit or blame for this, as the case may be. And it's been funded by a number of grants, as listed here. No conflicts of interest, I guess you could say, to report. Now, before I go into the modeling I've done, I want to talk about the purposes of modeling. Yeah, eventually, a lot of my previous work on SimSmoke is looking at past policies and validating those and using that to show the effects that policies have had to supplement statistical studies. The focus with e-cigarettes, because they're new, is of course on future public health impacts. Those are two important reasons for modeling. A third, and one that Eric already pointed to, and I want to strongly say is relevant here, is the heuristic element. By modeling, you're forced, A, to come up with estimates, empirical estimates from the literature, B, make assumptions, and C, try to put it all together in a coherent way. And I would argue that that is the stage we're at now and can help us in trying to untangle the health effects in the future. Before I talk any more about modeling, a couple warnings from my favorite prognosticator. One in particular I think that's relevant is, in theory, there is no difference between theory and practice. In practice, there is. Something to always keep in the forefront of your mind when you're thinking about e-cigarettes. A number of models have been out there. I should mention that, I've been modeling for a fair amount of time, doing work mostly with the SimSmoke model. It's an age-based model. It's an age-based model because we had stable patterns. We have stable trajectories, and that was useful, and it provided highly, well-validated predictive results. The newer models now are focusing on cohorts, and I think that I think all of the panelists would agree that that is going to be central to the way we look at things. As an aside, the original Surgeon General's reports focused on cohorts. We've gotten away from that. We now need to come back. Why do we need to come back? Because each cohort is subject to different products, to different awareness about the products and perceived risks about the products, and different policies regarding taxes, regarding public information campaigns, and so on. And that's only the tip of it. It's really much worse than that. One of the things that's going to be very difficult is we've really got to question what has been referred to as Markov assumptions, the assumption that there's stable patterns over time. A lot's going to depend on the previous experiences, which means the previous products, the previous trials, and so on. We know from cessation that past attempts, past quit attempts, are important in trying to determine what might work in terms of successful cessation in the future. This model, taking that very seriously, I've deconstructed and I focus on one single cohort at a time. And what I've tried to do is to bring some order to the chaos, is starting out with a decision theoretic framework and then look at things relative to a counterfactual. One of the other important distinctions that I've made, I think it's more to have to do with confusions in the literature, is to distinguish between trial and established use. And as you'll see, we have 4 different types of established use here. Now, the model I'm going to talk about today has to do with initiation. And when we think about initiation, we should always think about it starting off as never smokers. Even though lots of the early studies of initiation have found that these are people that smoked first, I'm not sure that's at all relevant. You know, the question is, what would they have done in the absence of cigarettes? Would they have been a smoker or not? That's the critical distinction from a public health standpoint. Then we look at trial use. And what I'm talking about here is trial use. I'm not talking about, well, they used it once and they ever use it. It's clearly not ever use. Ever use just probably means you have friends, basically, and you've been to a party at some point in your life. But what we're talking about here is some kind of more regular trial use. I would suggest something like at least a certain number of times within the last month. And then looking at that pattern over time, what transpires and what established state do people wind up with? Okay, and I have some probabilities here that I've used. And you'll see there's a big difference between the smokers and non-smokers. I'll come back to that later. So what we do is we develop a counterfactual using the data that's been developed by SysNet, which is based on projections on data up through 2012. And, you know, frankly, I was very lucky that we only went up to 2012 because that was before most e-cigarette use. So I would view that as a valid projection of what would have happened in the absence of e-cigarette, subject to some caveats, which I'll talk about in a little bit. Next is the assumption. So we assume, we look at these initiation rates, we assume you know, certain patterns. We look at later cessation, the effects of that, and so on. But the other important assumption we make for simplicity, but is admittedly an assumption that's going to need to be carefully considered later, is the use of other products. We use some risks. Now, when you look at these risks, keep in mind that these risks are meant to apply from somebody who starts de novo as a dual user. We would use for dual users the difference between risks between cigarette smokers and dual users would be a lot less probably from somebody who switches to e-cigarettes later in life. Here are some results for males. I'm just going to, look at the paper if you want to see those in more detail. What I want to get to, and what's really the crux here, is the sensitivity analysis. And what I want, I'd like you to first focus on the top lines, the dark green line and the dotted green line. The dark line is for otherwise smokers. And what's important there is to look at the variation from endpoint to start point. And you see it's much greater than for otherwise non-smokers. These are the people who wouldn't have smoked in the absence of e-cigarettes. That changes, however, at higher risks. It becomes more important to look at the otherwise smokers and what happens to them. This gives you some indication, I think, of the importance. You see something very similar as you look at the sensitivity for regular use. The last one is for dual use. And again, even there, you see that the real sensitivity is what happens to the people who would have smoked in the absence of e-cigarettes. Okay, so what comes out of this? Well, we find public health benefits over a fairly large range. We find it's relatively insensitive to future cessation. Of course, that wouldn't be true at later ages. And also, we find that it's very sensitive and therefore very important to distinguish what people would have done in the absence of e-cigarettes. And I have here a slide that talks about some of the issues which I've already alluded to. And the key in the future, again, is coming up with better measures. We can't talk about ever use anymore. last 30-day use is of limited value. We need to come up with measures that predict future patterns. We need to look at the data. We're going to have this data with PATH. We're going to have to look at it rigorously and use that to help determine what measures are useful. I've done some work with cessation. Here we distinguish a cohort 26 and 145. The difference being, of course, that at 26, patterns are still being established, cessation rates are low. Of course, we found big positive beneficial effects. At 45, there's still effects. They're, of course, much smaller because patterns are set. What's interesting in comparing these two models is you're going to see most of the trial, in the next couple of years. In other words, a 26-year-old is probably pretty much going to decide in the next 10 years whether or not e-cigarettes are for them. They may try it again later at 45 when, they find out that they're about to get a heart attack. But, it's going to be much less trial then. So the important distinction there is whether or not the individual would have quit. Implications are very similar. And so, again, I want to emphasize the importance of the measures and looking carefully at the measures. But before I go, I want to emphasize one other area that's going to create tremendous uncertainty, and that is the role of government regulations. And when we look at those regulations, we're going to have to look at the FDA regulations. We're going to have to also look at state regulations, which are now very different. Some are taxing, some aren't. How are they taxing? It's very different. Is it based on the liquid? Is it based on the initial purchase? And so on. And it's going to be important because we're going to need to look at how these affect the industry. And I've distinguished, and I think it's going to be important to distinguish the cigarette from the non-cigarette companies because there are different interests. The cigarette companies make a lot of profits. And so we're going to have to keep that in mind, and we're going to have to think about as we understand, as we try to untangle the effects of policies. With that, I'll conclude. And again, cohorts, cohorts, cohorts. And we need to not only look at cohort effects, but also how those effects change over time. Thank you.